Okay, well, our nutrition is already covered pretty well. The issues that you can have with certain consistencies and how to go back to the previous stage if you're not tolerating the food or the diet that you have at this point. But be focused on making sure that you chew well thoroughly and have small bites. What we don't want for the procedure is for you to be getting the food stuck and then vomiting, because this can generate movement of your stomach through the hiatal opening. Remember that the stomach is in the abdomen, but any forceful events in the abdominal cavity at this stage, the scarring is still not that well set in and it's not that strong to resist the pressure of a vomit or an excessive force in the abdominal area. So things can be displaced, and this can actually create a vicious cycle that promotes more vomiting and gradually move your stomach up into the chest, constituting a hiatal hernia. The problem with this is that later on you may have issues either tolerating harder foods, or you may have issues with acid reflux. It's not that uncommon at this point to feel some degree of acid reflux, but that is something that's going to get a lot better as the months go by. Right now the stomach is pretty rigid, and being a rigid cylinder, anything that goes into the stomach generates a lot of pressure, and it's easy for the food to kind of push up and down a little bit. But you have to be able to have your diet and the amount of fluids that you need, and all of that's just the habits: chewing well, slowing down, having small bites. And if you're doing all of those things and you can progress from the liquid phase to the mushy food phase, you have to let us know immediately so we can give you other strategies and figure out what's going on. A lot of people, this is not an inconsistent thing. A lot of people have issues when they jump to the next stage. Just take a step back, and then within a few days you'll probably be able to tolerate that next stage of liquids. If you have any unwanted symptoms at this point, you see any abnormalities with your incisions, any swelling, retention of fluids, weight loss is not going as expected, you have to let us know. You have to communicate this type of issue because a lot of times there are certain factors that can influence this, such as the body retaining a lot of fluids or the type of diet that you're having. Even with the liquids, if it's just consistent on very high caloric beverages and a lot of them throughout the day, they can affect the way your weight loss is going. Also, we need to make sure that you're active at this point. Most people actually return to work within a couple of weeks after the procedure is done. But if your work is physical, we want to make sure that at this point you're feeling energetic to be able to go back to work. Although your energy levels will not return to 100% until about 6 weeks to 8 weeks from the surgery. This is the time the inflammation kind of goes down and you start to feel a lot better. So it's not unusual for patients to be doing routines of exercise a couple of months out from the procedure. But at this point, take it very easy. Play it by ear because you can get winded. If you have any shortness of breath, please let us know. Any other symptoms that you might have detected, even if they happened a few days ago and they're not there anymore, it's something that's always a good idea to talk to us to let you know if it was something expected or unexpected. And remember, follow those written indications, and we're here for you 24/7. Any issues, communicate. Don't keep them to yourself. It is very, very important for us to know what's going on so that we can help you with anything during this recovery process. Remember, what happens now will have an impact as to your future weight loss and also everything else in regarding this procedure. So thank you.